Thank you, everyone, for joining us. We will be starting our presentation in just a few minutes to allow some people who are still logging in. At this point, you should be able to see our screen with our first presentation slide. Thank you, everyone, for attending today's virtual open house for the Master's in Patient Safety and Healthcare Quality program. I'm Kelly Curtis, one of the admissions officers here in the department for the Applied Science programs. I work with a team to assist students as they're exploring their options for continuing education. I would like to introduce Dr. Albert Wu, the program director. Dr. Wu, would you like to share a little bit about your background?
Sure, Kelly. Thanks very much. And I am very happy to be here on this webinar. Normally, I'm used to giving live lectures, but these days, of course, the webinar is becoming sort of usual practice. So I think we're all a little bit ahead of the curve, perhaps. I am an internist here at Johns Hopkins Hospital. I practice general internal medicine. Most of the time, I am a professor in the School of Public Health, where I direct a Center for Health Services and Outcomes Research. I also have an appointment in the medical school in medicine and surgery, incidentally. And I spend a lot of my time in the Armstrong Institute for Patient Safety and Quality here, which it's fair to say is one of the leading patient safety research and practice entities in the US or almost anywhere. We are in charge of quality and safety for the Johns Hopkins Health System, but also have a really large staff, about 140 people, who are working on safety and quality for education, for training, for research and operations. I've spent some time in Geneva at the World Health Organization. I worked there for 2 years in the patient safety program and continue to work there now. And maybe I'll mention this at some point during our presentation. And since about 2005, I have run patient safety education for the School of Public Health, the Bloomberg School of Public Health. So yeah, that's enough about me. Kelly, where should we go next?
We're going to talk about the agenda today, and thanks for sharing about your background. So Dr. Wu will cover an overview of the industry, provide details about the program, the curriculum, more about our online learning program here at Johns Hopkins, this Bloomberg School of Public Health, where we've been doing online for over 20 years. We'll touch on faculty, and then I will cover admission requirements, financial aid, and we will save some time for questions and answers at the end. So as you have questions that come up during the presentation, please type those into the chat box and we will address those at the end of the presentation.
I think we should be able to address virtually all of your questions that you might possibly have. So I look forward to getting to the end of our formal remarks. But patient safety and infection control are at the top of everyone's mind today. Peter Pronovost, who was the founder of the Armstrong Institute here and was until just last year the Senior Vice President for Patient Safety and Quality for Johns Hopkins Medicine, once said, organizations profess patient safety as a top priority, but they're still figuring out how to manage it with the same rigor, discipline, and accountability that they do their budgets. And I think that is still the case, though patient safety is becoming more business as usual. I think that you here online are potentially still at the forefront of this movement to promote patient safety and healthcare quality. The statistics that have been cited since early in the 2000s remain the same. In the US, about 1 in 10 people who are hospitalized are subsequently harmed in some way while they receive that care. There are at least 1.5 million preventable adverse drug events in the US, both outpatient and inpatient. And estimates suggest that the cost to take care of those errors, unnecessary tests, harmful misdiagnosis, and legal payouts exceed $100 billion a year in the US. We have only recently discovered that inaccurate diagnoses, which are a little hard to figure out, but which are prominent in the media, are perhaps the most common and catastrophic and costly of all medical errors. And in fact, we have a Center for Diagnostic Excellence here at the Armstrong Institute, and the president of the Society for Diagnostic Medicine is also on our faculty and talks about this during the course. Next slide, please. Now, increasingly, although in the past, frontline clinicians and managers have been committed to improving safety and quality, there's been a gap. The gap has been that there is not enough expertise, training, or even science that underlies the areas of work that need to be done, including designing projects, designing systems, data analysis, measurement, and those people who are enthusiastic do not yet have the skills. And in general, there has not, up to this time point, been a sort of a good resource or many good resources for developing those skills. The purpose of our course is to help individuals develop tools and skills that they could use in a career in patient safety. It's certainly true that patient safety and quality make a lot of sense and have a lot of appeal to all sorts of people, all sorts of disciplines. Certainly doctors and nurses have worked prominently in patient safety, but pharmacists, in fact, people in infection prevention, dentists, veterinarians, physical therapists, emergency medicine technicians, people in public relations and communications have all can now all find careers in safety and quality. Possible job titles include these. Most of these are a little bit more sort of straight down the middle: Director of Quality Management and/or Patient Safety Officer, Medical Director and Patient Safety Officer, Nurse Director of Quality Improvement, Risk Management and Quality Improvement Director, Director or Vice President of Quality Management or of Quality Outcomes, Quality Assurance, Patient Safety, Vice President of Performance Improvement, Patient Safety Officer, or even Patient Safety Consultant. And I think I know people who have all of these titles. Next slide, please. So our program is a full Johns Hopkins master's degree program, analogous to our MPH, to our Masters of Health Administration, to our Masters of Science in Public Health. This is a Master's of Applied Science in Patient Safety, and it's aimed at practitioners. And it is, although it has academic underpinnings, it aims to provide skills and tools for working professionals. Virtually all of our students are doing something else. I would say at least 80 or 90% have jobs somewhere in healthcare and are doing this part-time. However, the material is 100% online, with the exception, of course, of the synchronous live experiences that we have with every one of our courses. The total program requires 48.5 term credits, and this is designed to be doable even if you are working. A year is 4 terms. During each term, one takes 2 courses. Because this is a master's in public health, there are both patient safety and quality courses, of course, but there are also a few courses in statistics, epidemiology, and general public health that qualify you to have a master's degree in public health. The course runs for 2 years. However, if you want to, there are options to stretch that out over 3 years or even 4 years. There are courses, of course, but there's some professional development features, and there is an integrative activity in which you do a project of your choice that has to do with your interest or your work and integrates what you have learned up to that point in the previous 2 years or so. So we've been doing, as mentioned, we have been doing online education for more than 20 years now at Johns Hopkins. Our patient safety course, which began to run in 2005, was, I think, one of the first, if not the first, online patient safety courses anywhere. And I think we've gotten pretty good at it. Of course, there are recorded lectures, but there are opportunities for group learning. We use peer assessments. And as I mentioned, because this is very skills-oriented, every project is something that you might well do as part of your work doing patient safety or quality. And we really believe in things that are hands-on. Our goal is to educate patients on the measurement of safety and quality, on designing safer systems, on organizational and culture change, which is absolutely crucial, and on patient-centered care. Ultimately, what we're most interested in doing is not just preventing errors, but even more than that, preventing harm. Next slide, please. So here's the curriculum. And there are a few essentials of health courses. They're actually only a half a credit, and you can fit them in here and there. But in year 1, we begin with a little intro to academic and research ethics. Again, this is quite brief. And then we begin with a course on the introduction to quality of care. There's also a seminars in public health, which introduces a broad range of contemporary and relevant issues. Term 2 features the science of patient safety, one of the core courses, perhaps the core course. This is accompanied by case studies in quality and safety, which give actual examples of things that are being done to measure and improve quality and safety, both in the US and, in fact, internationally. Term 3 is actually devoted to a little bit of catching up with material that is essential for public health, an intro to epidemiology, which is designed specifically for the Masters of Applied Science, and a course on writing. When I was an undergrad, I actually took a lot of writing courses. At the time, I did it because it was fun, but I think that it is important to write, not just for publication, but to write convincingly for persuasion in virtually everything we do. Term 4, there's a statistical concepts in public health course. This is again taught by our outstanding biostatistics faculty who have the capacity to teach this material, which some people find challenging, in a way that is really understandable, and dare I say it, is fun. Our instruction in epi and biostat, I think, is world renowned for being sort of the best that one can get. Best, I mean, not because the material is the best, but because the way it is delivered, it is digestible and, as I said, engaging. There's a course on leadership for change. Leadership is crucial in patient safety, and if you do this course, you will come to be seen as a leader, no matter what your discipline in the work that you do, because in fact, you will have completed a master's level course at Johns Hopkins on safety and quality. And leadership and strategies for leading are crucial. Year 2, a second course on statistics, a course on quality improvement tools, which includes a fairly detailed presentation on a number of key methods and tools that can be used in quality and safety. Sort of root cause analysis is one example. Team steps is another, just for an example. Term 2 is the rest of epidemiology, and then seminars in public health, a continuation from that first term, first year. Third term, it's all quality and safety, measurement and evaluation, which are crucial in quality and safety. I think that we are particularly strong in evaluation methods. And again, you'd like to know how you're doing, so this is crucial. And infection prevention in healthcare settings. This is taught by the Director of Infection Control and Hospital Epidemiology at Johns Hopkins Hospital, someone who is actually extremely busy these days. It is co-taught by an infection prevention nurse who is a crucial practitioner and educator here at Johns Hopkins Hospital. Fourth term, there is a measurement lab in quality and safety. This is a little bit integrative and helps you apply what you learned in the previous term. And this can also be used, and should be used also in the integrative activity that you complete during that fourth term, though I will say that people start to do that integrative activity up in the first term of year 2, just to begin to do planning. So that's a little bit of an overview of the curriculum. Next slide, please. This is one of the most interdisciplinary things that I do. And the course is run and taught by faculty in the School of Public Health, the Bloomberg School of Public Health, the Johns Hopkins School of Medicine, where the Armstrong Institute actually lives, the Johns Hopkins School of Nursing, which I believe is the #1 graduate nursing program in the US, and the, I think, world-renowned Armstrong Institute for Patient Safety and Quality. The courses are all taught by practitioners and experts in the Armstrong Institute. These are people who every day are shaping the field of quality and safety through their research and particularly Hopkins' strength, turning research into practice and operations. We have long experience with online learning, and this would be you would be entering the 4th cohort of our Masters of Applied Science in Patient Safety and Quality. The courses have high production values, and I think that people find the activities are engaging and fun. What happens is that we have recorded course lectures, which are viewable from wherever you might be, at work or on your couch or wherever that might be. And there's a help desk available 24/7 for technical issues, which of course come up with online material. Next slide, please. I'm very proud of our faculty. I am currently directing the degree program, but have had a lot of help from Laura Morlock, who is our Dean of Education for the School of Public Health and has been doing risk management research for, gosh, perhaps 40 years. Peter Pronovost was also co-director with me when we started. He is still working in quality and safety, but is now adjunct at Johns Hopkins. I can highlight just a few of the people on our staff. Matt Austin, who's listed there first, is in charge of measurement of safety for the Leapfrog group, and is nationally known for this. Melanie Curlis is the nurse infection control provider who I mentioned. I've worked with her for 5 years, and she is a real force of nature. She's a very impressive person. Renee Dembski is in charge of safety operations for the Armstrong Institute. Cheryl Himmelfarb is the director of patient safety from the School of Nursing. Sydney D is a world expert on healthcare quality. Liz Golub is actually in charge of all of our Masters of Applied Science programs and will teach the EPI course. Lisa Maragakis is Director of Infection Control for Johns Hopkins. Jill Marsteller is a professor in the School of Public Health who specializes in evaluation methods. John McGreedy is a very colorful and accomplished and effective educator in biostatistics who has won countless awards. Lori Payne is the Director of Patient Safety at Johns Hopkins Hospital. Mike Rosen developed Team Steps, which is perhaps the most widely taught teamwork training method. He designed that for the Agency for Healthcare Research and Quality in the US, but is now on our faculty. Kathy Sutcliffe is the person who developed the theory of high reliability organizations and is the world's authority on this topic. So these are just a few of the faculty. I didn't get a chance to mention everyone, but everyone is strong and are terrific teachers. Next, please. So I'm going to pass off to you. So yeah, Kelly, go ahead.
Yeah, thank you, Dr. Wu, for sharing such great insight into just different aspects of the program and the need for advanced skill sets in patient safety and healthcare quality. So this is Kelly again. I will touch on the admission requirements. We do use a centralized application portal called SOPHIS. We require a bachelor's degree from an accredited college or university, looking for a minimum of 3 years of healthcare-related work experience. You upload a resume into the SOPHIS application portal, request 3 letters of recommendation, preferably from those that you work for. Your statement of purpose is an important part of your file to show how this program aligns with your educational and career goals. It's your time to explain kind of what you've been doing, what got you interested in the program, and what you're trying to learn and how you're planning to apply it. For our international students, if English is not your first language, you may need an English proficiency exam. And for those international students that have coursework outside of the U.S., we do require course-by-course evaluation. We do recommend using WES or World Education Service. So we do review files on an ongoing basis. As the sooner students submit their file and their file is verified that it's complete, it does go over to the admission committee for review. We do have one start a year. This year it is August 31st. The priority deadline is April 15th, and the final deadline is June 1st. And we do encourage students to apply early. So this slide touches on tuition and a little bit on the financial aid contact information. The tuition currently is $1,162 per credit hour. There is an OPAL scholarship that's unique to the applied science programs. That's $446 per credit hour. So once the OPAL scholarship is applied, the student's cost is $716 per credit hour. There's 48.5 credits in this master's program. So at the current tuition amount, you're looking at $34,726, with the OPAL scholarship applied. There's no separate steps that one needs to do to receive the OPAL scholarship. It is awarded to all students who are accepted into the program. And that does go through the length of the time that you're in the program, whether you finish in 2 years or whether you finish in 3 or 4 years. Here's the contact information for financial aid. We have a dedicated team there that can help students with the documentation once you've filled out the FAFSA form. And our school code is E as in excellent 00234. Do note that we may have a tuition increase. It often happens in the spring, so that will be noted on the website. So we'll open it up for questions. If you haven't typed in your question yet, please do so.
We are actively reviewing applications now. And I will say that some people, sort of write in and say, I did not attend Oxford University in England and go to the Harvard Medical School. Can I still get into this program? And the answer is that we would really like to accept anyone who can make a good argument for how this degree will help them achieve their career goals, and who has been able to show that they're likely to be successful in completing the program. So we are not really snobs about this. What we're really aiming to do is to train a workforce of practitioners who are qualified, who have enough academic qualifications to finish the program, but we're not. I would say that while Johns Hopkins is exclusive, our admissions requirements are not overly severe.
So I see that our first question has to do with the OPAL scholarship, so I think I can answer that. The question is how many students receive the OPAL scholarship? Again, it is awarded to all students who get accepted in the program. So there's no separate steps that you have to complete in order to receive the OPAL scholarship. So again, it is awarded to all students. We have a question, Dr. Wu. What are the expected software competency levels when you start the program? And what statistical packages or any other software that students need to be using during the master's program?
So there's no fancy software required. I think that we would like people to complete their. So everything is available online. You don't need special software to view or to work on the Course Plus site that we use. We like things to be submitted in a word processed form so that we can edit easily and give suggestions and comments. And any statistical software that you would need is available through the university. You do not have to buy your own statistical software packages.
Great, thank you. Let's see. Next question. Somebody wants to know if the slides will be made available after the webinar. They will be made available. Everyone will get those via email. I have a question here. The time commitment in taking 2 classes in each 8-week term is about 18 to 20 hours a week. Can you elaborate a little bit more on what those assignments look like?
Yeah, sure. So I think that that is probably an accurate description of the time required. The lecture material itself might be a third or a half of the time that is, maybe a third of the time that's required. We tend to require several small products for every course. So there might be several quizzes or exercises or memos to write. And I think that as long as, in my experience, as long as people can keep up, it's relatively easy to complete the material. Usually for most courses, there is a sort of a final paper or essay that is due. That is never longer than 10 pages double spaced. And so we're not looking for very, very long dissertations. Some of the work is group work as well, and that fills some of the sort of the requirements for completing any given course. We would like people to view the material, so we give them a little bit of credit for participating in the live activities. And we do expect people to view the lectures because, after all, this is online and that's all there is.
Dr. Wu, somebody is wanting to know a little bit more of the letters of recommendation that you require.
Yeah, so you can get letters of recommendation from anyone who is anywhere from a supervisor, manager, or boss to a colleague to a character reference, someone who is not strictly academic. And people are asked to judge your likelihood to be able to essentially to complete the material in the course based on your past experience.
Okay, great, thank you. And what kind of resources do students have access to during the program?
Yes, well, you have full access to all of the online resources of the university, and that includes a sort of a very extensive Welsh library site, which includes everything from all of the Johns Hopkins libraries, access to online journals and so forth.
Okay, great. Let's see what else is on our list. For the integrative activity at the end of the program, is it open to working with a community partner, or is it a simulation?
So you can do it with anyone you'd like. Some people do projects in their workplace that actually have to do with improving quality or safety. The requirement is that you, the student, design and write up what you have done, but you can have as many partners as you like.
And Dr. Wood, can you expand on that? They want a little bit more information on the final project paper, as far as maybe not necessarily who they would be working with, as far as a community partner or their own institution, but a little bit more about the details of what that looks like. Maybe give an example of what somebody has done previously.
Yeah, well, someone might decide that I would say this is a lot of variability. And we have some people who are working actively doing safety and quality in their institution. We have other people who have done some work clinically, but who are changing careers and are not currently working in safety and quality. We have a few people who are not strictly healthcare providers. Additionally, we have providers. We've had dentists. We've had veterinarians, and so the things that people have done vary widely. In some cases, the practicum winds up being a structured literature review. That's been done. More commonly, someone might decide that they have a problem that they've identified where they work. They want to investigate what the contributing factors might be to causing or perpetuating that problem. They might want to review the evidence that exists for potential solutions and then design a tailored solution to the problem and describe the evaluation that will be completed in order to figure out whether or not that intervention was effective.
Thank you. So I have somebody that's asking for clarification on the tuition, the Opal Scholarship, so I think I can cover that. So the cost per credit hour is $1,162. The Opal Scholarship that's awarded to all accepted students is $446 per credit hour. So when you apply the Opal Scholarship to $1,162, you'll get $716 per credit hour. That's the student's cost. And then with the 48.5 credits in this master's program, if you're doing the math, then you'll get $34,726. You're paying for those credits or courses as you take them in each 8-week term. So I hope that clarifies the tuition and the partial Opal Scholarship.
So you are not required to pay 2 years or even 1 year worth of tuition as a lump sum upfront. This is different from what I'm paying, the tuition that I'm paying for my children's schooling at a private school, where they require everything in August, and God forbid you should leave at any time before the next August. So you pay per course, and if you decide that you wanted to do the program over 4 years instead of 2 years, then you wind up paying less, obviously, per year because you're taking fewer courses. I will say that the tuition for this master's program is just about half of the tuition for our Master's of Public Health, our MPH degree. So the tuition rates, though not insignificant, are pretty favorable if you think about it as stretched out over 2 years or even more than 2 years.
Yeah, thank you, Dr. Wu. I have a student asking how many students are in the program now. I don't know if it would be easier to answer that question as far as how many students started last fall. And then also, do you have an idea of how many students have graduated already?
So let's see, we have, this is our 3rd year of the program. So in the very first year, I think we matriculated something like 48 students. Of those, I think something like 36 graduated exactly on time with their cohort. So that means that a couple of the others are stretching out the program. A few people realized that this wasn't the right thing for them, given what they were doing. One guy, I recall, was an assistant professor of cardiac surgery at a major university, and at some point said, I don't know what I was thinking. I don't have time to do my job, much less take another degree. I'm going to have to take some time off. And we were, I mean, that seems reasonable. So in that first year, 36, I think, out of 48 walked at graduation. And the funny thing is that about 25 of those people showed up on campus and actually attended graduation in Baltimore, despite the fact that one of them was from Australia, one was from Kenya, one was from Nigeria, one was from Japan. People just felt like they wanted to, maybe having done all of this online, they figured it was a good excuse to make a trip to Baltimore. In the second year, we enrolled, I think it might have been close to 100. I think it was 98 people. So that is a group that would be graduating this spring. The numbers are not in yet, but I expect that the large majority of those people will graduate. So that's approximately how we're going. Last year's class, I think 85 people enrolled. I'd expect that there'd be something close, somewhere in that number, certainly more than 50 people, perhaps close to 100 people are likely to enroll.
And Dr. Wood, would you say that just because of the support and the flexibility of the program that we have a high graduation rate?
Yeah, I mean, it seems so, especially given the fact that people are not, are not all traditional students. There are some people who have not been students for quite a long time and are re-entering. And some of those people have a little bit of a harder time doing anything academic because they haven't done it in 5, 10, 20 years. But I think there really is a lot of support for that person. We understand that that's sort of what you get if you're doing entirely online education. I think we're pretty sympathetic to that.
With you mentioning those attending graduation, if someone is planning a trip to Baltimore, can they arrange to meet with different professors?
Sure, you can always, the faculty is happy to meet with folks. Absolutely.
We have another question. I think I can answer this. It's how does one submit the recommendation letters? In the SOFAS application portal, you request your recommendation letters. A notice does go out directly to those that you want to write a letter of recommendation, and then your recommenders submit their letters directly back into SOFAS.
So I get I write letters of recommendation for people periodically. And so what happens is you get an email from SOFAS, the central collator or processor of these things. And they say, so-and-so has requested that you submit a letter on their behalf. Click here. When you go in, you see the person's name and you write the letter either on your word processor or right on the site and load it.
Yeah, thank you for that clarifying how the recommendation letters are requested and arrive back into SOFAS. The next two questions tie in together. There's a question about teaching assistants. And if a student needs assistance, for example, on understanding an assignment, what different support do you have? I mean, how easy it is to reach out to the professor or a teaching assistant to get, for example, clarification on an assignment?
So every course has teaching assistants. The teaching assistants are PhD students in the School of Public Health who are concentrating on patient safety. So they are people who know the subject matter quite well. There is for any course, there is approximately one TA for every 25 students. So there's a pretty good ratio of people around to help. Every student is also issued a faculty advisor. And there are 5 additional faculty who play that role. So one can get assistance or advice or mentorship or guidance from one's faculty advisor. And those people are, again, all people who are on the staff at Johns Hopkins working in patient safety.
Thank you. That was very helpful. I have a student asking another question about the application. I think I can answer this question. There's no additional application steps, no supplemental application steps beyond the steps that are required in the SOPAS application portal. And I can highlight that it's uploading a resume, uploading a statement of purpose. There's sections that have to be filled out, 3 recommendation letters to be requested, and of course, transcripts from each school attended. And there's one other question about the GRE or GMAT. No, we do not require that. That is part of the application steps.
If you are dying to send it in, you can, but it's not required.
Okay. I think that might be all the questions we have, and it looks like we should probably wrap up the time that we have today for this presentation. Thank you everyone for joining us. I hope you found the information helpful. If any additional questions come up, feel free to reach out to us. My contact information is on the last slide, and we do have a dedicated team here to work with students. If you are wanting to move forward immediately with the application, you can use the scan code to move forward with starting the application. And again, we are here to assist you with questions and support you through the process. We have a lot of support here with the program. Thank you, Dr. Wu, for again providing such great insight into the program. Everyone have a great rest of the afternoon.
Yeah, I will. Let me close by saying that I have pretty good evidence that this is the premier online course in patient safety and quality that exists in the U.S. or anywhere. We're very proud of it. It's taught by top experts. We have a lot of experience teaching this material, and the people who have taken the course have been, I think, extremely satisfied. Some of them have, I think that the people coming through for graduation is good evidence for that. But in addition, people send us in testimonials describing the jobs that they got, or what they feel like they're now able to do on their jobs that they were not able to do previously. And that makes us happy. That's our goal. We would like to increase the base of patient safety experts, which I think are really sorely needed now that the World Health Organization just last year has declared that patient safety and healthcare quality must be built into every aspect of universal health coverage, and primary care, which they are both promoting heavily. I think the market for practitioners and researchers in patient safety and quality will only increase. So anyway, thank you for joining us today.
Thank you, Dr. Wu. That was an excellent conclusion.
Thank you all. Hope to see some of you see your applications. Those of you who feel it's appropriate, looking forward to seeing them soon. Have a great day, and hope you are able to keep out of the way of too many COVID-related encounters.